Protecting and advocating for patient rights in healthcare. Understanding client rights. Client rights form the foundation of ethical healthcare delivery, ensuring patients receive fair, respectful, and safe care while maintaining their dignity and autonomy. Definition: legal and ethical entitlements that protect patients during healthcare encounters. Purpose: protects patient autonomy and dignity while ensuring safe, high-quality care. Foundation: built on trust between patients and healthcare providers. Compliance: ensures adherence to legal and ethical healthcare standards. The Patient's Bill of Rights. The American Hospital Association established key rights that all patients possess during healthcare encounters. Fundamental patient rights. Right to information: patients must receive accurate, understandable health information. Right to choose providers: patients can select their healthcare professionals. Right to emergency care: patients cannot be denied emergency treatment. Right to participate in decisions: patients have input in their care plans. Right to respect and non-discrimination: patients must be treated with dignity. Right to privacy and confidentiality: medical records must remain secure. Right to file complaints: patients can report issues with their care. The nurse's role in protecting client rights. Practical nurses serve as patient advocates and guardians of client rights in healthcare settings. Core responsibilities. Advocate for patients when rights are compromised or threatened. Educate patients about their rights and available treatment options. Ensure informed consent is obtained before procedures and treatments. Maintain confidentiality and protect patient privacy consistently. Report violations when patient rights are at risk or compromised. Respect cultural and personal beliefs when providing care. Understanding informed consent. Informed consent represents a fundamental patient right that requires careful attention from nursing professionals. Elements of informed consent. Complete explanation of the procedure and its necessity. Risk and benefit discussion including possible outcomes and complications. Voluntary decision-making without coercion or pressure from staff. Patient competency ensuring mental capacity for decision-making. Opportunity for questions to ensure full understanding. Who can provide consent? Competent adult patients. Legal guardians for minors or incapacitated adults. Healthcare proxies when patients cannot consent. Right to refuse treatment. Patients maintain the right to refuse care even when it may result in harm to their health. Key considerations. Patients must receive full information about refusal consequences. Against medical advice, AMA, forms should be completed when appropriate. Healthcare proxies make decisions for unconscious or incompetent patients. Nursing responsibilities. Provide education while respecting patient decisions. Document refusals thoroughly and accurately. Notify providers and healthcare team members promptly. Confidentiality and HIPAA protection. The Health Insurance Portability and Accountability Act protects patient privacy and medical information. Protected health information includes names, dates of birth, and social security numbers, diagnoses, treatment plans, and medical procedures, billing information and insurance details, authorized access, the patient or their legal representatives, healthcare providers directly involved in care, approved family members with proper authorization, confidentiality exceptions, suspected abuse or neglect situations, public health emergencies and disease reporting, court orders and legal requirements, right to file complaints. Patients have the right to voice concerns about their healthcare experience and seek resolution. When patients can file complaints. Experience of unsafe care or medical errors. Violations of their rights or discriminatory treatment. Mistreatment by healthcare personnel. Where to file complaints. Hospital administration and patient relations. state health departments and regulatory agencies, the Joint Commission and Medicare/Medicaid services. Nursing support role: help patients understand the complaint process. Report unethical or unsafe practices to supervisors. Advocate for patients throughout the resolution process. Legal and ethical framework. Client rights operate within a comprehensive legal and ethical framework that guides nursing practice. Legal foundation. Patient advocacy laws requiring nurses to act in patients' best interests. State Nurse Practice Acts defining scope and legal responsibilities. Federal regulations protecting patient rights and safety. Ethical principles. Autonomy, respecting patient choices and decisions. Beneficence, acting in the patient's best interest. Non-maleficence, preventing harm to patients. Justice, providing fair and equal care to all patients. Overcoming barriers to rights protection. Several barriers can interfere with protecting patient rights, but effective solutions exist. Common barriers and solutions. Language barriers, use professional medical interpreters for clear communication. Cognitive impairment, involve legal representatives or family members appropriately. Cultural differences, provide culturally sensitive care and respect diverse beliefs. Fear of speaking up, encourage open communication and create safe environments. Practical steps for ensuring patient rights. Nurses can take specific actions to protect and advocate for patient rights consistently. Daily practice actions. Educate patients about their rights and healthcare options. Advocate actively when rights are at risk or threatened. Respect informed decisions even when personally disagreeing. Maintain confidentiality at all times and in all situations. Document concerns including refusals and advocacy efforts. Report violations of ethical standards or unsafe care practices. Summary and professional commitment. Client rights protect patient autonomy, privacy, and fair treatment throughout healthcare encounters. Informed consent and the right to refuse care represent fundamental principles that nurses must uphold. HIPAA ensures privacy of patient information while nurses play critical roles in education, advocacy, and rights protection. Legal and ethical principles guide nursing practice in upholding patient rights consistently. Key takeaways for practice. Patient rights form the foundation of ethical nursing care. Informed consent requires full disclosure and patient understanding. Privacy protection is both a legal and ethical obligation. Advocacy is an essential nursing responsibility. Thank you for watching and learning about client rights. Your commitment to protecting these rights ensures that patients receive respectful, dignified care while maintaining their autonomy and safety.